This is a test. I'm Jessica Lobine, and my study focused on spirituality and spiritual caring in nursing based on the environments of acute and palliative care settings. Nurses come from all different kinds of backgrounds to provide a goal of caring for their patients, and spirituality starts at a young age, and it changes with different perceptions, experience in nursing, education. I can redo it.
Oh my God.
I'm stuttering to it. I'm Jessica Lobine, and my research topic was spirituality and spiritual caring in nursing, with nurses' perspectives and practice in palliative and acute care environments. Nurses come to their caring profession from many different personal and cultural backgrounds, and their academic preparations, experience, and education have been recognized to impact their delivery of their spiritual caring and their influence and ability to practice it. The research problem here was that spiritual caring is difficult to articulate. It has many different definitions, and it began with a Judeo-Christian definition, but there's so many different takes on it. It's hard to, like I said, define spirituality and describe spiritual care in any kind of setting. The research questions that this study brought to the table was: do perspectives of spirituality differ between acute and palliative care RNs? Do RNs practice spiritual care in palliative and acute care environments? Does spiritual caring practice differ between these two groups? What barriers do spiritual caring experienced by RNs in palliative and acute care? And do RNs' spiritual perspective and spiritual caring practice influence barriers in the nursing? So my critique was in Sydney, Australia. It was a cross-sectional study, and it compared palliative and acute care nurses in their environments. The framework was unidentified, and it was a comparison study. It was based on 7 intermetropolitan health services, like I said, in Sydney, Australia, 4 of them being the palliative care environments and 3 being acute care settings. There were 42 palliative RNs that participated in the study and 50 acute care RNs that participated in the study, which made for a small sample size. The contact was initially made with directors of nursing services, then proceeded to nurse managers to receive people that would participate willingly in the study. They collected data by questionnaires based on 3 different questionnaires, one being a socio-demographic questionnaire, one being a spiritual perspective scale, and one being the spiritual care practice questionnaire. The 2 spiritual scales were research tools, and they were tested for validity. The SPS measures a person's view on the extent to which they consider to which spirituality has an impact on their own life, where the SCPQ measures the frequency of assessment and the interventions related to the practice and the barriers providing spiritual care to patients. The SCPQ scale was only used on acute care RNs. The results of this study: there was differences in qualifications. Starting as a palliative care nurse, they had several more years of experience in a setting, so they were also older women, which means that they had less of an education, maybe just like a certificate, something like that, or like attended just a nursing school, not to receive their BSN, where the acute care RNs were of younger age, they hadn't been in their specialty as long, they were not as employed as long, and but they also did have more qualifications when it came to their bachelor's in nursing. The palliative care nurses had significantly higher scores on both the tests and questionnaires that they did, the SPS and the SCPQ scores. The problem, the limitations of the study included that the acute care nurses were not from all different areas. They're from general surgery, orthopedic, and never included anything from the ICU. Although they were asked to participate, they never actually participated in the study. The implications of nursing here is that you have to know yourself and know your spiritual beliefs to help someone else. This can be reinforced by education programs either offered in classes attended outside of the hospital or going to classes that the hospital also offers. You can document your spiritual caring. Documents not just about what medication you gave. So if you helped a patient, you can document spiritual caring. You need to integrate it into their care plan. You have to build a relationship with the patient to understand what their beliefs are in spiritual caring, and then integrate it into their care plan to also help them get better. And to do all this, you have to begin to establish a trusting relationship with your patient from day one. All in all, it proved that because acute care RNs are focused on the disease or the problem at that time, they forget or lack building a spiritual relationship with their patient or understanding the patient's spiritual relationship. Where the palliative care RNs, they're at their end of life. They were hospice nurses and community nurses, so they know more, they build relationships, they're there longer, they reconcile their life. So they definitely focus more on spirituality. So spiritual perspective is higher in palliative nurses. Acute care will benefit from additional support. And all in all, spirituality is a component of a holistic nursing.